This is David Ross, editor of the Valley Roadrunner, and this is Valley Center TV. This afternoon, we're bringing you an interview with Captain Joe Basinski of the Valley Center Fire Protection District, and we're going to ask, the subject today is the coronavirus. Joe, are you attending the county EMS emergency medical services meetings, and what role do you play?
Behind the scenes, there's a lot going on, both within our agency and regionally. As the emergency medical services officer for Valley Center Fire, as well as the infection control officer, there's been a lot of meetings going on, and they're all phone meetings lately, but still it's definitely taken up the schedule. We've been having meetings within all of the EMS representatives within each agency in what we call the North Zone, which is basically all of the departments from the ocean to Valley Center. Those have been occurring almost daily, and those are just to kind of keep up on pulse checks, making recommendations on how we can keep up with the changes that are almost going on daily. In addition to that, there's some other kind of working groups that are assigned different projects, and with that we represent the North Zone, and we're working collaboratively with county EMS.
What should the community be doing regarding COVID-19?
Really, the best thing you can do is to pay attention to different media outlets. Whether it's here or the TV, and kind of pay attention to what those latest changes are. For right now, we do recommend staying home. The social distancing is a real thing. If you do happen to go out, wear your masks, and when you come home, wash your hands frequently. And we are recommending that you kind of keep keep cleaning the house. 10% bleach solution or other CDC approved cleaning agent. Bleach would probably be the easiest one, and that's just wiping down the surfaces that are commonly touched: phones, tables, chairs, computers, and maybe doing that a couple times a day depending on the household traffic.
Well, we all know that the worst is still to come. What is our region, the northern San Diego County region, doing to prepare for that?
There's a lot of things that have been implemented. Let's start with Valley Center, what we're doing, and Valley Center Fire is on par with all of the other departments in the zone as well as countywide. So within our department, we are our staff is doing daily temperature checks. It's actually 3 temperature checks within a 24-hour period, and at the first sign of any type of a symptom, then that gets reported up to ultimately me, and then we can make decisions from there. One of the biggest priorities is making sure that our employees are staying healthy. That way we can continue to work when the expected spike comes. We can have full staffing. In addition to that, as far as responses, if you've seen us or if you've called us, you'll see that our personal protective equipment that we're wearing is drastically different. We're on every single call. We're wearing N95 masks, protective glasses. We always wear the gloves. We've now started wearing triple barrier medical jackets, and in some cases, depending on the call type, we're also putting a full medical gown on.
If somebody thinks that they are sick, what should they do?
So there's different resources out there. So depending on your symptoms, so we're classifying severe symptoms as severe respiratory distress with possibly some associated chest pain. So the key with that one is the severe respiratory distress as it relates to COVID. That would be the trigger where you would end up calling 911. If you have a low-grade temperature of in the area of 100 with maybe slight respiratory systems complaints and maybe muscle aches, flu-like symptoms, then 211 is a county hotline that's been set up, and you can call them and they might be able to divert you into other resources, whether it's seeing your own primary care physician, whether it's recommending sending you to one of the testing sites in the county. But with this, not all patients need to go to the hospital. We're also trying to keep an eye on that as far as keeping the hospitals clear and not getting inundated for, again, if there is a potential spike that could occur within the next few weeks. So 211 would probably be your first line of defense if your symptoms are mild, again, flu-like symptoms, low-grade fever, slight shortness of breath. But if those persist to severe respiratory distress, then that would be your trigger to activate 911 or go to the hospital.
Has Valley Center Fire changed the way it responds to calls as a result of this pandemic?
Currently, if somebody calls 911, they're still going to get a fire engine and an ambulance at minimum. We're going to be dressed differently. We're also working in a partnership with our dispatch center, where every single call that comes in through our dispatch center, they are asking pre-screen questions. For example, they're asking, have you been around any positive COVID patients? Have you had any recent fever or cough? And do you have any flu-like symptoms? So those are some of the pre-screen questions that if you were to call 911 right now, they would ask you that. In addition, they're also asking you if you are able to walk and a non-trauma patient. So for example, if you fell, they might not ask you this. But if you're able to walk on your own, can you go outside? If you have your own inhaler, bring that with you. But if you could go outside to meet the fire department instead of having them come in the house. And we're going to show up wearing all the gear that I previously mentioned.
Has the procedure changed since we found out last week that we have cases of COVID here in Valley Center?
No, nothing has changed on our end yet, because we were expecting some people to pop up positive in the community, and there's going to be more that pop up. That's the reality. We as a department, we're prepared for that, and we as a community need to be willing to accept that. And so nothing that we're doing different as of right now is different. So we're still protected with our clothing, and we're going to continue to care for the patients. Now, what may change if call volume ends up changing, then we may up staff resources, put extra fire engines or different response vehicles into the system. That way we can keep up not only with our call volume here in Valley Center, but also as a regional resource, because our fire engines and ambulances don't just run calls here in Valley Center. We can and do get pulled into Escondido and surrounding areas as a closest appropriate resource. So that may occur depending on region-wide call volume.
To your knowledge, are those who have been ID'd as having the virus been quarantined? Have any been sent to the intensive care unit?
So for For the ones that we know within our community, I can't actually say if they are in the ICU or even hospitalized. There is, in San Diego County, there's approximately 250, depending on the day and the hour is really what it boils down to. There's about 250 people that are hospitalized, and within that there's about 95 that are in the ICU. So that's countywide. So we're still seeing a little bit less than 20% of the total in the county is requiring hospitalization, and less than 10% is requiring ICU care. So a lot of these positive patients are being discharged home. They're given home care instructions, and they're given instructions on if symptoms were to persist, then here's the recommendations. Again, 211 versus 911, and then we can go from there. So with the ones in our community, I'm not sure where they currently are, but those are the percentages as far as hospitalizations in the county.
When Valley Center first learned that we had local cases, no doubt many people became anxious, to say the least. What would you say to those people?
First off, there's no need to, create pandemonium. The fire department pushed it out in some of their social media that we will get positives in our community, and that happened a few days later, and it was announced through the local media outlets, and we're gonna get more. That's just the fact of how this works. Again, you guys to protect yourselves, stay home, wear your masks, wash your hands, clean your houses, and those are the biggest things that you guys can do. So we have a few in Valley Center, and we're going to get more.
Do you think that social media is overreacting to this situation, causing more anxiety than might be warranted?
I think overreacting might be a strong word. I think there's a definite cause for concern, but that cause for concern doesn't necessarily revolve around if we have positives in our community. The cause for concern should be with everybody watching over yourselves and watching over your family and following the regulations that have come out and the regulations that potentially may still come out. So that's how we're going to protect ourselves. That's how we're going to limit the spread locally as well as regionally, is by following those things that have come out and will come out. And the people who are sick and will get sick locally, they're going to follow what they're told by the healthcare professionals, and if need be, we as the fire department are going to be there to take care of them as well.
Now, you'd mentioned earlier that the firefighters have new gear that they're wearing,
Mm-hmm.
or that we may have not seen before. Is there enough of that gear? Does everybody have enough?
Yeah, so everybody has those triple barrier medical jackets that we don't always wear. We have rolled those out into our response plans because of this. We always have access to the glasses,
Mm-hmm.
and those are washable. The N95 masks, as you guys have been hearing on the news, those are reserved for healthcare professionals during this time. For you guys, you should be wearing some sort of a face covering, probably something washable. But yes, we do have access here within our department. I think right now we're right around the 400 count of N95s, and then regionally we have many more than that. So, and we have access through government resources if we need more.
Now, what part do local firefighters play in the regional response to the disease?
In the regional response, we have our chiefs and myself. We're right now busy with meetings and different planning activities, and we have our homework cut out for us as far as the planning and the rollout of this successfully locally as well as regionally. As far as the firefighters, that are driving around in the fire engines, we already talked about how their day-to-day life has changed as far as temperature checks and the gear that we're wearing. But basically, we're all ready for it. When we get a call for service, whether it's here in Valley Center or an outlying city, we're going to be ready to respond to that. There's going to be units available, and we're going to have trigger points that's based off of kind of call volume that'll dictate if we have to provide additional resources into the system.
What did Valley Center Fire Protection District do to prepare for this response?
So, let's see. We saw this coming, and we're keeping our eyes on this back in January, February time, and we started ordering more supplies as far as masks and gowns, and just to kind of get ready, because we were able to see ahead and realize that if we waited, then those supplies might not be there. And if you're watching the news lately, then you find out that a big problem is getting access to those masks for hospital employees, for first responders. It's difficult to order them now if we wanted to place an order. So we did that a few months ago because we were keeping our eye on this at a global level and expecting it to be here. So now that it's here, we're a little bit more prepared for that. We've been holding trainings. We held one a few weeks ago that was for all of the departments here in the Valley reservations and as well as Valley Center. And that's proper donning and doffing of the gowns. So if we have a gown on and we're dealing with an infected patient, then it's safe to assume that gown might be infected itself. So there's certain procedures that have to be taken into account for taking that gown off appropriately. That way we're not just ripping it off and throwing it in the trash and further spreading possible contaminants. So there's certain ways of doing that. So we had a training on proper donning and doffing of all of the clothing, and we were able to work out some of those kinks early on, and that went well. We're done with that, and we are sending out a lot of information because this is a lot of the tactics and strategies that are revolved around this are almost changing on a daily basis. So there's a significant amount of inter-department and inter-region communication that's taking place, and we're pushing that out to our fire agency as soon as we can, and just kind of rolling with the punches and making implementations as soon as they come out.
One other thing, what do you, if the people who are identified as having the disease, what do you do to possibly notify other people who might have come in contact with them?
So that's kind of a county and a little bit of the hospital system responsibility. For example, if we were to transport somebody to the hospital for, let's just say, flu-like symptoms, a fever, coughing, and we transport them, they end up at the hospital does a test, and then a few days later those test results were to come back to the hospital, then the hospital actually, and if they were positive results, then the hospital notifies obviously the patient, they notify the county, and then the hospital does notify the department representative, in this case me, that we did transport a positive patient. That way we know that some of our staff may have been exposed, but with the proper use of our personal protective equipment, that exposure may not have even happened. But it just gives us an idea that we did come in contact with somebody, and to kind of kind of keep our eye out. So once that patient is notified, then there is a communication link set up between that patient and the county as far as kind of watch out systems. It gets added to the total count that we see that keeps coming out, and they're now kind of in the county system, whether they're hospitalized or receiving care at home.
For those people who want to keep up to date and well informed about the coronavirus locally, what can you suggest some resources?
Yeah, I know you guys at the Roadrunner have been putting out a lot of daily information. I think it is okay for the community to know that the status of our community. It's okay if we have positives here in the community. And a lot of people within the community are also kind of chiming in and providing comments. I know the Valley Center Firefighters Association is pushing out updates every few days on anything that may be changing. I know the Roadrunner has their new app that just went in, and those are all good resources. Additionally, I mentioned it, 211 is a good county resource if you think you might be getting sick, or if you think somebody you know is getting sick. There's a lot of people that are staffing those hotlines, and they're able to answer your questions.
I guess there's also the VC Strong website as well.
Yeah, there's a lot of this community, being the way that it is, did rally together, and a lot of things got put into play, and all those different entities are working together, and it seems like it's all of those are good resources.
Well, thank you for making yourself available for this interview this afternoon, Captain Basinski. We really appreciate it. And viewers, keep checking the valleycenter.com website. Check for updates on Valley Center TV, and pick up your copy of The Roadrunner.
Thanks for having me.
Thank you.